Welcome to our channel. If you need immediate medical attention, follow these step-by-step instructions to decide whether urgent care or the emergency room is appropriate. Step 1. Assess the severity of your symptoms. Life-threatening conditions like chest pain, difficulty breathing, severe bleeding, or stroke symptoms require emergency room care immediately. Step 2. Choose the emergency room for serious injuries such as suspected broken bones from major trauma, deep wounds requiring stitches, severe burns, or head injuries with loss of consciousness. Step 3. Visit urgent care for minor injuries and illnesses. These centers effectively treat sprains, minor cuts, mild infections, flu symptoms, and other non-life threatening conditions. Step 4. Consider urgent care for issues needing prompt attention but not immediate life-saving intervention. Examples include mild asthma attacks, moderate back pain, or urinary tract infections. Step 5. Call 911 for true emergencies where immediate transport is critical. Don't drive yourself for chest pain, stroke symptoms, severe injuries, or any condition where you might lose consciousness. Step 6. Understand cost differences between facilities. Emergency room visits typically cost 3 to 4 times more than urgent care, even for the same condition. Step 7. Check if your urgent care can handle your specific need. Call ahead to verify they have X-ray capability, can perform minor procedures, or treat your particular condition. Step 8. When in doubt about severity, err on the side of caution and choose the emergency room. It's better to be safe, and ER staff can always redirect you to urgent care if appropriate. Don't forget to like this video and subscribe to our channel.